Hi, my name's Corey. This is my video for our assignment, our second assignment in Nurse 730 on depression, and our scenario with Marley, 16-year-old with depression. I will talk about why I chose Prozac for her and what serotonin syndrome looks like, as well as ethical and personal beliefs surrounding that. Depression involves changes in the brain circuits that regulate mood, motivation, sleep, and appetite. Neurotransmitters like serotonin, norepinephrine, and dopamine may be imbalanced or not used efficiently. In major depressive disorder, these changes can persist for months, leading to low energy, loss of interest in things that make us happy, and sleep disturbances, appetite changes, and negative thinking patterns. Biological, psychological, and social factors are interacting as sort of like a combination that contribute to major depressive disorder, and for some, treatment helps by gradually restoring balance in the brain, signaling and improving mood and functioning. I chose Prozac. It's a SSRI, a selective serotonin reuptake inhibitor. It increases serotonin signaling in the brain, which can help improve mood, energy, sleep, and interest in activities over time. It has a long half-life, which I thought was appropriate for Marley because it makes withdrawal symptoms milder if she misses a dose accidentally, and it also provides steadier effects for some people. It's commonly used in adolescents with moderate to severe depression, and it may also help with associated symptoms like anxiety, poor concentration, which Marley described she was having. Prozac is also chosen often when low energy and social withdrawal are prominent, as improved mood can help with motivation and daily functioning. So that's why I thought it was a good one for Marley to have. Side effects are, as with all SSRIs, the nausea, sleep changes, headaches, appetite changes, fatigue, dizziness, and sometimes sexual side effects. Sometimes people do feel more anxious and restless at first, but this often improves with time and dose adjustments. There is a risk of serotonin syndrome, which we'll talk about in a moment. And there also is with teens in particular, adolescents, it needs careful monitoring, especially with teens, because there is a unique risk for mood changes and suicidal thoughts and ideation with teens. So this really needs to be monitored closely by a clinician and parents, family, and Marley, and explaining to Marley if you have these thoughts, obviously that's not normal, and to please speak up and say something, so she can be a good historian too in that way. So yes. So to talk about serotonin syndrome, she does talk about in the scenario how she comes into the ED and she has symptoms of SS, and what to do in acute management for Marley would be to stop the serotonergic agents because serotonin has built up in her system too much, and it's having really bad effects. So with serotonin syndrome, you assess the severity. Mild would be anxiety and mild tremor versus moderate to severe, which is agitation, high fever, marked autonomic instability, hyperreflexia, altered mental status. So If these symptoms are being shown, as they are with Marley, monitoring her vitals, treating a fever, IV fluids, oxygen if necessary, continuous monitoring for heart rate, blood pressure, temperature. And then for moderate to severe, when the agitation and restlessness persists, benzodiazepines are appropriate. And if it really is severe, Marley would have to go to the ICU. So if her symptoms escalate and they're not resolving, any signs of severe hyperthermia, rapid deterioration, altered mental status, hemodynamic instability, requires urgent escalation and ICU admission. So it's important to educate Marley's family and her that SS is a potentially life-threatening reaction to too much serotonin signaling due to medications. Again, telling them mental status changes, autonomic changes, neuromuscular changes, so tremor, muscle rigidity, hyperreflexia, and what to do. If it looks like this is what might be happening with Marley, make sure to tell her and her family not to take any more SSRIs and to get help immediately. So there was a question about if SSRIs due to SS should be listed as an allergy. It's not a true allergy because it was drug induced, so it's not an intrinsic allergy. So it's to answer that question. And some of my professional and ethical reflections, how beliefs, empathy, and communication from myself can be affected by my personal experiences and bias. Like I said with schizophrenia, we all, at least I do, I've had my feelings about, in my life about people with schizophrenia, or in this case, depression. And so we do have biases. And I think the more that we are educated about the neurobiology of major depressive disorder and serotonin syndrome, it highlights that it is from complex neurochemical reactions and changes, and it's certainly not from a person not making the right choices, or a weakness in their character, or non-compliance. These conditions are truly not the person's fault. There's not a lot that they can do. So this really shifts my thinking from judging the person to understanding and empathy. This also applies to Marley identifying with being non-binary, and just really embracing her in that journey, being supportive, making sure that she's got a network of support and community around her, because that's not her decision either. And it is who she is. So getting my own bias out of the way is very important. Another issue that I am very aware of is, and becoming more aware of, is the importance of Marley and her family, but most importantly Marley, that she is educated about her treatment plan, and can make her own choices about her treatment plan, so that she can have the autonomy, especially as a 16-year-old. It's very important to be involved in your own care and to you're learning to become more independent and making choices for yourself so that for your well-being and longevity and happiness in life. So this is a great opportunity to let Marley make some of her own decisions about the medication and the therapist she would have, because therapy would definitely be a part of the treatment plan, and just being really aware of what she is going through and that it's not her fault. So those are my thoughts about professional and ethical reflections. Thank you for listening, and I'll see you next time. Thanks.